fibrosis is an inherited disease characterized by an abnormality in glands that produce sweat and mucus. Cystic fibrosis affects various organ systems in children and young adults, including the respiratory system, the digestive system, and reproductive system. Due to improvements in treatments, people with cystic fibrosis on average live into their mid to late 30s. Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today we're going to go over another 5-minute mind map. So what we're going to discuss is cystic fibrosis. So as I was saying earlier, cystic fibrosis is genetic, okay? Now, both parents do need to be carriers of this mutated gene. So if they receive only one gene from one parent, they will then be a carrier of the mutation, but they do not have cystic fibrosis. So they have to have the gene from both parents. Okay. Now it affects exocrine glands, causing thick mucus production. So any gland that produces mucus, sweat, any type of fluid for the body, these are the glands that are affected by cystic fibrosis. Now, you can expect repeat respiratory infections. There is no cure, and the patient does have a decreased lifespan. Now, what are some of the signs and symptoms that you will see in patients with cystic fibrosis? So fatigue, chronic cough, recurrent upper respiratory infections, thick, sticky mucus, chronic hypoxia, so clubbing of their nails, barrel chest, fatty, frothy poops, low absorption of vitamins, abdominal distension, decreased digestive enzymes, rectal prolapse, and meconium ileus in newborns. So this is when the meconium is thicker and stickier than normal meconium, and it causes a bowel obstruction in the infant's bowels. Now, cystic fibrosis is diagnosed through a sweat chloride test. This is when they put a mild electrode on the skin and they use a sweat collection device to determine whether or not a patient does have cystic fibrosis. Now, how is cystic fibrosis treated? So we know that there is no cure, so we really need to just manage the symptoms. So treatment is through diet, increasing calories, protein, fat, and salt, pulmonary therapy, chest physiotherapy, breathing exercises, and aerosol treatments. And the meds that they could be on are antibiotics, vitamins, aerosols. So these are your bronchodilators, your mucolytics, and your pancreatic enzymes. So that is all I have for this video, guys. I hope you did enjoy this 5-minute mind map. If you are looking for more of these mind maps, you can check out my Etsy store. I do have the link down in the description. But once again, that's all I have for this video, and I hope to catch you in my next one. Bye for now.